So good. I was going to say good morning, good afternoon, everyone. I am Jessie Whittish with Kentucky Youth Advocates. Thank you all for joining us today at our Policy and Advocacy Information session. This is about the halfway point of Children's Advocacy Week. So this is pretty exciting, and just before this got started, there was some talk about bills that had come out of committee and bills that had dropped. So this is also really exciting as it's the second day back into the General Assembly after that recess. So this is great timing. We ask that you stay muted today, but if you have questions or comments, or like you just want to give like an amen, or an oh my God, I can't believe they said that, please include that in the chat because that's really helpful just for follow-ups, or that's just frankly the best way we can all engage with one another. And we'll try and answer questions as we go. So today you're going to learn more about the Blueprint for Kentucky's Children policies, and hear from a couple legislators about the 2021 General Assembly and why we need you to be an advocate for Kentucky kids. So before we start with that, I am going to turn it over to our partner co-hosts to introduce themselves and share a little bit about their organizations. We are honored to have Metro United Way, Neighborhood House, and CASA of the River Region as our co-hosts. And so I would like to welcome Teresa Reno Weber, Jenny Jean Davidson, and Will Myers, respectively. So we're going to get started with Teresa.
Thank you so much, Jessie, and happy Children's Advocacy Week. Thank you to Kentucky Youth Advocates for bringing our Commonwealth champions for children together to help raise our voices and connect with our legislators. I am Teresa Reno Weber. I'm the president and CEO of Metro United Way, where we fight for the education, economic mobility, and health of every person in Jefferson, Bullitt, Oldham, and Shelby counties across Kentucky. And we do that and have for over 100 years by engaging people to give, advocate, and volunteer. And when we talk about the advocacy piece of our mission, we are referencing the full spectrum of action, from encouraging civic engagement, to gathering data, to convening and educating, to shaping and advocating for policies that support equity and opportunity for everyone in the region that Metro United Way serves, as well as across our Commonwealth. And we know that policies made right there in Frankfort have the ability to fortify or fracture the pillars of support that we work to build across all of our network of more than 100 nonprofits and other partners across the community. And so we so proudly stand beside and are grateful to the leadership of Kentucky Youth Advocates in this space. And one of the key priorities that we share for this legislative session is in expanding childcare access to best serve kids, families, and our local economies. It's a vital step in increasing access and quality and making sure that everyone has the ability to afford high quality childcare assistance. And so I do want to just highlight our ask around the Childcare Assistance Program, or CCAP, which you all know is vital to not only family support, but workforce. And it is specifically designed to build self-sufficiency for working and degree-seeking parents. But the program has been steeply underfunded at the state level, a challenge that is clearly now compounded by COVID-19 pandemic and the threat of federal corrective action due to untenable low rates at which participating providers are reimbursed for care. We are losing child care centers by the day. We know that we had lost over 45% of our centers across the Commonwealth before the pandemic ever hit. And so without immediate investment to increase CCAP reimbursement rates, we will see an acceleration of those losses. So we join KYA today and throughout this session in asking policymakers to make an urgent investment of $2 per child per day in CCAP reimbursement rates to develop a strategic long-term investment plan to build quality and increase program eligibility. So our Director of Public Policy, Mandy Simpson, is here today. I might not be able to stay for the whole thing, but she will be able to help answer questions and lead this conversation on behalf of Metro United Way. And we look forward to continue to working with all of you as well as beside Representative Fleming, Senator McGarvey, and all their colleagues to help support our kids and families. So thank you again, Jesse and the team, for having us here, and to our other partners, including Jenny Jean, who I'll hand it over to now.
Cool. Thank you, Teresa. My name is Jenny Jean Davidson. I'm the Executive Director at Neighborhood House. We are a full service, full family community center in Louisville's West End, as we say, from the twinkle to the wrinkle. If you got somebody, we got something for them. We operate a early Excellence Academy preschool and child development center, a youth program, family coaching. Our senior program is virtual at the moment, so we're staying in touch with our seniors by phone, email, drop by, porch visit, any way we can. We have kids in the building, about 80 kids in the building every day, including 40 kids who are coming to us for their NTI, which is an adventure. We are kind of where the rubber meets the road around kids and families. So all the things that are important good public policy are showing up right here at Neighborhood House. So for example, to Teresa's point, an increase in reimbursement rates for CCAP would allow us to make more investments in the quality experience that our kids can have at Neighborhood House. We are also a Face It partner, and KYA are our good friends. So I just thank you guys so much for the work that you guys are doing and for keeping us all in the loop as we think about what's best for Kentucky's kids and families. And I will then turn it over to Will with CASA of the River Region. Hey, Will.
Hey, thank you. I appreciate it. As mentioned, I'm William Myers. I'm with CASA of the River Region, and CASA stands for Court Appointed Special Advocates. There are about 23 CASA programs in the Commonwealth. I see my colleague Colleen is here from Northern Kentucky, and our program specifically serves Jefferson, Henry, Oldham, Trimble, Shelby, and Spencer counties. So a mouthful there of our 6 counties. And what we do is we train people from the community, advocates from all walks of life and all backgrounds, to be advocates for children, to go into court with them, to advocate for them on behalf of what their needs are, to make sure they're going to the doctor, make sure that they're going to school, and really receiving a consistent adult in their life who's going to advocate for them and ensure that they have access to what we believe all children need. So that's our mission. We've been in existence since 1984, and we're really proud of all the good work that our volunteers have done since that time. And we are part of the Blueprint as well as part of the Face It initiative. And I also have to just really thank KYA, because these last couple of years, I've been in this position since 2013, but I've been in social services my whole professional career. And so many strides have been made on behalf of children in terms of child abuse, especially, which is our focus, but also so many things that affect children positively in the Commonwealth have really been able to happen because all of us have worked together and have worked on the blueprint and made things happen. So I am so thankful to be part of that. And I'm so excited of what we're gonna see is gonna happen soon. So that's me.
All right, thanks, Will. And thank you to not only our co-hosts, but all of the partner organizations who are joining today and have been joining all throughout Children's Advocacy Week and who are in Frankfurt every day. And Will was talking about CASA Volunteers, and I just want to give a shout out to all the volunteers of any kind. We've seen a lot of CASA volunteers this week during Children's Advocacy Week, also a lot of Citizens Foster Care Review Board volunteers we've seen this week, and those of you who are volunteers with a different organization, but you are, have it in your heart to show up for kids, just thank you. I think it's really great for you to take that time out of what I'm sure is a very busy life. So thank you. Okay, so we are going to try and get our brains moving a little bit here, maybe get our hearts moving a little bit too with some Zoom polls. So we are going to ask, I think there are 4 questions, and if folks could answer those, and if you want to add a little bit more context to your answer in the chat, that would be wonderful, just so folks can see a little bit more of your experience. So let's see. Okay, can you see this question? Approximately how many kids live in Kentucky? We'll wait a few more seconds. Okay, I think just about everyone has answered that. So you are correct that there are more than 1 million kids who live in Kentucky. So way to go. I think we got that about 2/3 of the way correct. So, or 2/3 of us got that correct. So, and somebody else on here may have the exact number. I think it's like 1,270,000, something like that. So it's actually a lot more than 1 million, which is about 1 in 4 Kentuckians. You can learn more about that data in the Kids Count County Data Book released every year. So, okay. Okay, now, oh, no, not that one. Trying to show you the next one. Hold on. Okay. All right. Can you see this one? How long have you described yourself as an advocate? We've got some veterans. Okay, it looks like most folks are either kind of a, I wouldn't say a rookie, but are like a rookie to amateur or a veteran. So most folks falling in the 1 to 5 years or more than 10 years. So let's just shout out to all of those veterans. Okay, and those are the results. And I will move on to our next question. Maybe, oh man, to question 3. All right, how many children's advocacy days have you attended? And if you want like a bonus point, which is like, I don't have a prize for you, but you can share what your first children's advocacy day was, if you want to put that in the comments. Okay. So for some of you, this is your first time. Some have attended a lot of children's advocacy days, like at least a few or 5. So like I said, share what like your first year in the chat there. And then our final question, it's not that one, is this one. All right. What is the advocacy action you are most proud of? Here we go. People are still voting. All right. So as you all can see, the #1 answer here was being there for a child when they are struggling. And I know lots of times when we at KYA talk about advocacy, we mean like, are you calling a legislator, or are you showing up at a rally? But you know, that being there for a kid or a family when they're having a rough time is really being an advocate for them, and is also a great tool to take to that other kind of advocacy for policy change. And our second answer around building support for policy change among friends, family, and colleagues, that is so important because, you know, legislators' minds change when public opinion changes. So it's so important to build support among a network of people who care about kids and their families. So thank you all for getting into the polling a little bit. We appreciate that. And so now we are going to transition to talk a little bit more about policy. So we're going to talk about the Blueprint for Kentucky's Children policy priorities. Some of you may be familiar with this. Some of you may not be. And like I said, please feel free to drop any questions or comments you have in the chat. With that, I'm going to turn it over to my colleague, Patricia Tenen.
Thanks, Jessie. And hello, everyone. It's really fun to see you guys here and our good partners from all across the state. And I've seen a few of you, I'm recognizing you, seeing you in multiple events through the chat. So special shout out to you all for really taking full advantage of all the opportunities we have this week. So I'm going to start off to share with you about our Blueprint for Kentucky's Children. I know many of you are familiar with it. For some of you, it'll be the first time. So we'll try to move through really quickly just to give you some highlights about this really important agenda we have. I'm going to start with priorities that have not been filed yet as bills, and then we'll move into bills that are currently moving in the legislature, or hopefully moving, that we need your help to take action on. So the Blueprint is a coalition of over 100 statewide partner organizations, including our host today and many of you who are here on the call. And we represent nonprofits, public and private organizations that speak with a common voice to create brighter futures for Kentucky kids. And every year we launch a policy agenda that stands on 3 pillars, which are thriving communities launch strong families launch successful kids, and successful kids launch a prosperous future for Kentucky. And we know that when we all work together, that's how it happens. And as the Commonwealth works to overcome the impact of the COVID-19 pandemic and address systemic racism, we believe these policy priorities can be implemented during the 2021 Kentucky General Assembly without being included in the state budget. I'm going to share with you some priorities. We know the budget is a big deal this session, but there are a number of ways that we can, common sense solutions we can enact that wouldn't cost any money. And these are ways to strengthen Kentucky's efforts to prevent child abuse and neglect. We've seen, again, unfortunately, that we rank at the very top, and which is calls for policy action now from our legislators. And here are some concrete ways that we hope you'll lift up. We can extend the statute of limitation for misdemeanor sexual abuse cases involving minors. The current statute of limitation expires 5 years after a victim's 18th birthday. And we think that if the bill passes, it would be extended to 10 years after the victim's 18th birthday. We also want to remove the clergy penitent privilege exemption. So currently, the clergy are not exempted, as everyone else is a mandatory reporter except for clergy. And we think that this is important to ensure that any disclosures of suspicion of child abuse and neglect are reported to proper authorities. We also want to modify the mandated reporting law to disallow chain of command procedures. If we eliminate the chain of command reporting procedures and public and private agencies, what we've seen is internal policies that mandate that workers report disclosures of abuse to their supervisor, who will then open an internal investigation before reporting it to the DCBS or the police. And this bill would mandate that whoever received the disclosure reports that disclosure. We'd also want to establish a minimum age threshold, which at least 12 years old, that a child can be charged with an offense. And currently, children of any age can have a complaint filed against them and brought before a judge. In fact, in 2020, the youngest was 8 years old. And we believe that it's time to establish a minimum age so we can increase opportunities to connect young children to community-based resources instead of sending them through the maze of the juvenile justice system. In addition, another priority is to minimize the impact of parental incarceration on children by holding parents accountable in ways that prioritize substance use treatment and community-based alternatives to incarceration for certain offenses. We know that 1 in 15 Kentucky children has had a parent incarcerated. It's at the 3rd highest rate of parental incarceration in the country. And this is indeed a shared sentence for children along with their parents. It impacts them in many ways, and it's time that we address that and that negative impact that's having on our kids. And then finally, we would like this, we want to amend local planning and zoning laws to allow regulated home-based family childcare options to safely serve children in their neighborhoods. And actually, there's an update on this piece. We actually do have a bill that was filed by Senator Danny Carroll. It dropped yesterday. It's Senate Bill 148. And the need for this bill is that regulated home-based family childcare options have been in decline over the last 10 years. We know that they are particularly important in rural areas, but also in urban areas. They can, they're an option that are preferred by many parents of infants and toddlers, but also for families that might want to have the same cultural connection. Maybe the caregiver can speak the same language as their children, share a cultural background. They also provide care for, during odd hours. It could be weekends or evenings. During the pandemic, they've been particularly helpful for our healthcare workers. And so in the last 10 years, Kentucky has experienced a dramatic decline in these. And part of that problem that we have heard from partners are planning and zoning requirements. And so we think this is one way that we can support and ensure we can expand the number of family childcare homes so that all parents who want to work and need a safe place for their child while they're working have a place to go. So thank you for your patience as I ran through that very quickly. And now I am going to turn it over to my colleague, Courtney Downs, to talk about some bills that have already been filed.
Okay, thank you, Patricia. And I'm just going to take a few minutes to go through these priorities. These are great ones to reach out to your legislators about, and ones that we hope to see continuing to move through the legislative process this year. So the first one that we want to talk about is our House Bills 42 and 54. Both of these would allow state employees to access 12 weeks of paid family leave after the birth or adoption of a child. There is bipartisan support for this issue. Representative Raymond, who is a Democrat, is a sponsor for House Bill 42, and then Representative Nemes, who is a Republican, sponsors House Bill 54. And as of right now, the only difference between the two is that House Bill 54 says that the 12 weeks of paid family leave have to be used within 24 weeks of the birth or adoption of the child. That's the only difference. So we know that paid family leave allows families to be there for those important first moments in their children's lives. There are proven short and long-term health and well-being benefits, as well as proven returns on investment for employers. Currently, Black and Hispanic workers are less likely to have access to paid family leave than people who are white. So improving access to this benefit would boost family and economic stability for every eligible family. Next, we can talk about House Bill 147, which is sponsored by Representative Mosier. She is a Republican and co-sponsored by Representative Bojanowski, who is a Democrat. So again, there is bipartisan support for this bill. And this one would allow city and county governments the options to regulate the youth sale and distribution of tobacco products, including e-cigarettes. And I also want to point out that Senate Bill 81, which is a companion bill, was filed in the Senate by Senator Julie Rocky Adams. And currently both bills are identical. So what that means is that if they both make it through their respective chambers without any changes made, then the bill can immediately go to the governor's desk to be signed. So here's a couple of things that we know. City and county governments see firsthand how effective tobacco control policy can improve the health of their constituents over time. So when they're given discretion, they can respond more appropriately and quickly to the local needs. They can tailor ordinances that meet those needs, and they can develop effective enforcement measures. However, a current state law prohibits or preempts local jurisdictions from enacting stronger tobacco control measures to reduce tobacco use. So basically what we're talking about here is local control, and some examples of what that could include are setting standards on tobacco retailer density in neighborhoods, and then also setting up buffer zones between tobacco retailers and schools or playgrounds. And this is important because we know that children are more likely to smoke if they live in or go to a school in a neighborhood with high tobacco retailer density. And we also know that tobacco retailer density is higher in urban neighborhoods. It's higher in neighborhoods with higher percentages of Black residents and also low income neighborhoods. So in other words, kids who are low income or who are Black are disproportionately at risk of using tobacco. Next, we want to talk about Senate Bill 36, which is sponsored by Senator Whitney Westerfield and is currently assigned to the Judiciary Committee. Senate Bill 36 would expand judicial discretion when deciding whether or not to transfer a case to adult court when the youth is at least 14 years old and a firearm is involved. So right now, KRS states that judges are only allowed to consider the age of the youth, whether a firearm was involved, and whether a felony was alleged to have been committed when deciding whether or not to transfer the case to adult court. So those three factors are the only ones that they can really consider. The gun doesn't have to work, it doesn't have to have been discharged, and if there's more than one person involved, even if they aren't in possession of a firearm, they'll all be held to the same standard. Under any other circumstance, using any other weapon that you can think of, judges have a full discretion and they can use a range of factors to help them when they're making this determination. So those factors can include the seriousness of the offense, the child's previous record, public safety, the maturity of the child, what's in the best interest of the child and the community, and then a few other factors. So if this bill passes, judges will be afforded the same discretion in cases involving firearms as they are in every other case. And then finally, I want to talk about House Bill 192, and that is the budget bill. It was sponsored by Representative Petrie. He's the chair of the House A&R Committee. And this would enact a continuation budget that, among many other things, will impact children's health coverage, their health care, education, and their safety. And for those who don't know, when I say a continuation budget, it's exactly what it sounds like. Like they are trying to continue the one-year budget that was implemented in 2020 into 2021. So the Kentucky House and Senate have both passed House Bill 192, and now the appointed members from both chambers will participate in something called a conference committee. And this just gives them the opportunity to negotiate the deals of the state budget before the final gavel next month. So we have a detailed budget priority checklist that we can share with you, but I will also give you a couple of the highlights really quickly. So one thing that COVID highlighted is the need to prioritize broadband. So currently Kentucky is 40th in the nation. And so we are advocating for funding for that infrastructure because we know that it is essential for school and then also for things like medical with telehealth. We want to ensure that dedicated funding is implemented for expanded care services and to support student health. We want to sustain funding for Family Resource and Youth Service Centers, or FRISCIs. And we also want to prioritize sustained funding for kinship caregivers. And so this means two things. We're ensuring that every eligible kinship caregiver knows about and receives the relative caregiver support benefit, which is a one-time stipend that can be used to purchase any necessities that they need, like school supplies, formula, bedding, clothing, things like that. And then we're also ensuring that front end, I should say, preventative services like respite care are always available to kinship and fictive kin caregivers whenever they need it. Next, I want to go over a few of our child welfare budget priorities. So this would include strengthening funding for programs like K-STEP and START. We know that substance use played a significant role in over half of the cases involving kids who were removed from their homes. These programs are proven effective in helping parents achieve sobriety, but then it also gives them the opportunity to safely care for their children while going through this process. And it's also important to point out that for every dollar that gets spent on a START program, Kentucky saves $2.22 in out-of-home care costs. We also want to continue funding for the HANDS program, which is an evidence-based in-home visitation program that is proven to increase adequate prenatal care. It lowers the rates of preterm birth and low birth weight, and it also lowers incidences of child abuse. We want to increase funding for forensic services for children who experience child abuse and neglect for the third year in a row. We have the highest rates in the nation. And we specifically want to increase funding for the pediatric forensic teams that are based out of the University of Kentucky and the University of Louisville. And finally, we want to ensure that the safety net programs that exist like SNAP or WIC and KTAP aren't modified in ways that keep children who need these benefits from receiving them. So I know that that is a lot of information to give you all at one time, but we expect that some of these bills will have committee hearings pretty soon. So keep looking out for those and using our bill tracker.
Great, thanks, Courtney. I dropped this in the chat at one point, but talking about a number of these issues, you can see that they are very rarely just about the child, and much more often Jenny Jean, I am stealing this phrase, twinkle to a wrinkle policy, because so many of these are like kids have adults in their lives, and we're talking about environments for kids to grow up in, to learn in, communities for them to grow in. So some of you, I know you work at really different kinds of organizations, you volunteer with really different kinds of organizations, and so hopefully you are kind of seeing this in your work. We wanted to hear from legislators today, and we have one legislator that we're going to have a live conversation with, and then we have a video from Senator Morgan McGarvey, who represents a good chunk of Jefferson County, kind of like down the middle part of Jefferson County. I believe there's a caucus going on right now that actually involves a number of Louisville legislators. So he was not available, but he sent a video. So I'm going to play that video for you really quick, and then we're going to transition to a Q&A.
Thank you so much to everyone for standing up for Kentucky's kids. Unfortunately, we need it now more than ever. Just today I saw in the paper that Kentucky leads the country in child abuse for the third year in a row. This is unacceptable, and we can do something about it. First, we need to make sure in this budget we continue to invest in family drug courts. We know all the kids who are coming in, who their families are broken up, they're facing all sorts of obstacles. They can be helped through the family drug court setting. We need to follow the blueprint set forth by Kentucky Youth Advocates. We know that our future is based on what we do today with our most precious resource, our kids. Numbers like this can't stand. And together, with all of us standing up and being advocates for all of our kids, we can and will make a lasting difference.
All right, so thank you to Senator McGarvey for his message, and I would encourage any of you who may live in his district to reach out and say thanks. Or he is also the Senate Minority Leader, so it's really appropriate for every Kentuckian to reach out to him as he is in a leadership role. So now I am going to turn it over to Mandy Simpson, and Mandy is the Public Policy Director for Metro United Way, and she is going to facilitate a conversation with Representative Ken Fleming, who represents part of Jefferson and part of Oldham County, and we really thank him for making time today to join us. And thank you, Mandy, for kicking off this conversation with him.
Thank you, Jesse and Representative Fleming. It is great to be with you. We also serve Jefferson and Oldham counties as part of our footprint, so we're proud to stand by your side in serving those constituents. We also know that you're a big champion for children, and you've gotten to hear about the Blueprint priorities today, both the issues on the radar and the specific legislation that's filed and could be moving. So first, we'd just like to hear from you, your thoughts on the priorities that we've talked about today and your priorities for kids in this session.
Well, thank you very much. I appreciate allowing me to join y'all and try to listen in on a lot of your priorities and so forth. To be honest with you, I did not catch all your priorities, to be honest with you. I was supposed to be in a committee meeting. I got out earlier, but I had like 3 or 4 people come in, which I had to take care of a couple of the issues that I have some bills going through. So I do apologize that I really can't comment on that because I really didn't hear as much as I should. But you know, I am very conscious and mindful of kids and giving them the resources and support as much as possible. When it comes to, particularly comes to mental health, some of y'all may or may not know, but I run a mental health center for the past 6 years. I left the private sector and sold my company, and now I've been doing this for a while. And the kids that I see come through that talk to our therapists, as well as have an outreach with the West End School, the kids come a very dire situation to get them over the hump, to get them to participate in society and be a really strong contributor to society. We provide a lot of services to help them out with that. So, you know, a couple of the bills that I did catch really briefly, you know, they sound and look very solid in terms of trying to advance and helping out the kids. So, yeah, when it comes to, you know, mental health and giving them the financial support as well as the mental health support, yeah, I'm always open ears to those issues and those initiatives. So once again, I apologize. I wish I could comment on them, but I've had back-to-back meetings today. It's no excuse, but Ben and I have been texting a lot, which Ben's been absolutely wonderful to work with. And so I've been trying to juggle things to come out and meet there because that was a priority to me to come and just, you know, sit down and listen to y'all. If you have any comments or questions, I will try to answer them, but I really want to hear more from you all than anything else.
Well, Representative, there's no need to apologize. We can only imagine what it must be like. What are we, 2 days after the recess, coming back with the many people who want your ear? We're grateful for the time, and don't worry, we will always follow up to talk more about the Blueprint priorities.
I'm sure you will, and Ben will be right there.
But I don't want to let you off the hook just yet. We have a few more questions. You know, and more broadly, in a year where it's tough to predict what is coming, it is tough to understand what kind of allocations we might be able to provide into our communities, and we're managing a lot of uncertainty, but we also are managing a lot of urgent need. What can advocates for children be hopeful about? Where is their opportunity? You've mentioned mental health. What things would you like to see move forward as we have time this session?
There's got to be stronger policies and a stronger effort in terms of funding mechanisms. That has been insufficient for years. And that's part of what I'm trying to accomplish. And sort of, not want to say a backdoor, but it's sort of an approach that I'm trying to do is that people always harass me about I'm a data guy. Well, I am, I like numbers and so forth, and numbers usually tell stories. Well, what I'm trying to accomplish is looking at tax reform and trying to take money that there are $7 to $8 billion of tax exemptions that the state allows, which is fine, but there's quite a bit of money that can be questioned, and there are obviously carve-outs. So what I'd like to do is try to find that money, which I've identified several areas already, and reallocated those to those areas, either through tax credits or through direct fundings to those higher priority items. One of which, I mean, it could be either manufacturing, but to me, it's more for mental health. And I'm trying to shift money to try to find money within the budget, not to really go out and capture new money, but get within the budget to put it more toward mental health issues, and particularly the kids, because you know as well as I do, and y'all in it day in and day out. There's a lot of bombardment with these kids, and being at home, not having the resource. In fact, and I'm getting sort of babbly, but you know, it really bothered me. I had several constituents call me up, and they're telling me that they both the parents have to go work, and so the kids are there, and they're 15-ish. They leave, they go to the store, they steal the alcohol, they come back, drink it, and get alcohol poisoning. You know, it's like there's a underlying issue and problem with that. The behavior is not good, but there's something that's more granular in terms of getting kids aware and supporting parents, either single or parents or two parents, to give them support to do that. So I'm trying to look at things from a monetary financial point to shift money over to those areas, such as, you know, kids and supporting the parents and those kids. So I hope I went too long-winded, but hope that gives you an idea a little bit of what I'm trying to accomplish.
Absolutely, Representative. And I have to say, if you're a data guy, you are talking to the right people. Shout out to the Kids Count Data book, which helps us all tell the story of what kids are experiencing and what their lives and what their success can be right here in our Commonwealth. And I will also tell you, thank you for doing the very hard work of not just saying we need more money, but that this is where it could come from, because that's the first question that we know we always need to answer when we talk about funding in the places that are going to make the biggest difference for our children. So why do you, and you actually alluded to this in your story about talking with your constituents, but why does the work of those of us who advocate on behalf of children matter? Why do our voices matter in policymaking spaces?
Yeah, basically, y'all basically where the rubber hits the road. You're the front lines in terms of going out there and deciphering and figuring out, you know, where the vulnerability is, where the holes, either from a legality standpoint, from a monetary standpoint. So the more efforts that can be made from a PR and messaging standpoint to get the word out, because as I said a few minutes ago, we're get bombarded with people tweeting things out, or Facebook, or the news media. We gotta break through that, you know, that cloud, that barrier, and it's just going to take a lot of discipline and focus to go out there and do that. So I would continue to do what y'all are doing in terms of, you know, bringing down the barriers and trying to find those opportunities where, you know, we can get together to get some funding and some policy. So I hope that answers your question. But like I said, I think y'all are basically the front lines, just like, you know, the doctors and nurses are front lines. You know, my clinicians, they're in the front lines. And when I was running my companies, I always put my efforts, my focus, no matter if it's supporting them with materials or financial support, they're out there in the front lines, and that I'm basically their customer. So in reality, you're my customer because you're out there servicing the kids. It's sort of a warped way of looking at it, but that's how I look at stuff. So I'm more of a servant than anything else to help support what y'all trying to do.
Well, we want to link arms and work by your side. And thank you for the inspiration to keep lifting our voices, knowing that they do matter so deeply, especially to you. Thank you for your leadership. What is the best way for us to contact you? What's the best way for us to engage with you specifically and with your colleagues?
Yeah, sure. Well, I think it's really more important, and I do appreciate the groups coming together during session and rallies. But I would, and I'm sure y'all have done this, and Ben's done it with me, and Ben's been a great in staying on me. And that's good. In non-session time, there's got to be a stronger level and effort of contacting with your representative or your senator in their home office, or wherever they are, and you go to them. To me, some of these legislators are like the old bankers. They sit back and let them come to you. Those days are gone. So I think if y'all can be as proactive as possible in contacting through emails or phone calls, or I wouldn't tweet anything out. That's sort of, I don't know, that's another issue. But I would just pick up the phone and just meet them in their district, and talk with them, and get them. Always when I was running our national association, when I talked to senators and congressmen on the Hill, I always left with a call of action. Basically, put it to them, say, what can you do? Here's what we want to do. Can you commit to this? If you can't commit to this, then I'm going to stay on your tail and tell you one way or the other which way you're going to go. So I would be more proactive in meeting within their home, and not get them over the lip service that some of them do. So.
Thank you for that candor. And you heard it here, everyone. We have our marching orders, meetings in our districts with a specific call to action. Representative, thank you so much for your time. Thank you for being a champion for children. And thank you for continuing to work with us moving forward.
Thank you very much. And I appreciate what y'all doing and so forth. Keep up the good work. And obviously, if you got an open door with me, and just let me know what I can do and then help out and go from there. But y'all have a good, blessed day.
Jesse, I'll kick it back over to you.
Great, thanks, Mandy, and thank you, Representative Fleming, for joining us today. Before we go, we wanted to hear a few words from Aetna Better Health of Kentucky. Aetna Better Health is our signature sponsor for Children's Advocacy Week. But even more importantly, as some of you may know, they have recently kicked off the Supporting Kentucky Youth, also known as the SKY program, which is providing Medicaid supports for all kids in state care. So I'm going to show a short video from their executive director, Kelly Pullen, to tell you a little bit more about the SKY program and how you can learn more, particularly if you work with kids who may be in state care.
Hello, fellow advocates. We are so excited that it is Children's Advocacy Week. We are delighted to be with you here today. I'm Kelly Pullen. I'm the executive director for the SKY program here at Aetna Better Health of Kentucky. And at Aetna, we are so excited about this week and really excited about the rally, because that's when hundreds and hopefully thousands this year, as we go virtual, will come together to show our collective support for Kentucky's kids and families. We also know there are not a lot of event opportunities for our kids to share the same stage with Governor Beshear and our House and Senate leadership. Aetna knows there's no better way to make connections with advocates who care about kids than this week. And an event like this is especially important this year, given the pandemic and the systemic inequities that we see, particularly with our vulnerable kids and families in the state. And furthermore, Aetna Better Health is honored this year to support the critical work that we know Kentucky Youth Advocates does to help the Commonwealth in their commitment, again, to meet the needs of our children and family in the state. This year is extra special for us at Aetna because we were selected to manage the state's new Supporting Kentucky Youth program, also known as SKY. And this really means that children and youth in out-of-home care, including former foster youth, youth who are placed in kinship or relative placements, Medicaid eligible youth in the juvenile justice system, and children and youth in out-of-home care and adoption assistance youth began receiving their Medicaid coverage through Aetna starting in January. And in addition to covering Medicaid benefits, we are going to be providing a high-touch approach to care management for this population. And this really helps children and families navigate the systems and make it easier for them to get the resources that we know that they need. Our care management team is going to be helping Kentucky's children and families find local providers, schedule appointments, and even help these members get rides to and from their medical appointments. And we will also be providing extra bonus benefits like cell phones, laptops, and wireless plans to some youth so that they can maintain those very important connections to their support system. Members in SCI can also get other extra benefits to set them up for success, like GED prep classes, job training, life and financial skills coaching, and much more. Plus, we offer a few other helpful extras like our duffel bag program that's full of essential and fun items and a surprise birthday box that includes, well, we don't want to really ruin the surprise for you all. In addition to these extra benefits, we will be working really closely with the families that our youth and providers and others who are involved in these children's lives work with, so that we can help equip them with the tools they need so that together we can achieve the best possible outcomes. We will be providing free training to the stakeholders that are in the child welfare and juvenile justice systems. Some of our free training includes a trauma-informed care overview, which really provides an overview of the components of trauma-informed care and the impact of adverse childhood experiences. And another training I get really excited about is our Human Trafficking 101 training. In this training, we're really helping our participants understand what human trafficking is, what resources are available, and help them learn how to meet the complex behavioral health and support needs of this population. If you are interested, upcoming events and opportunities like these that I just mentioned will be online at www.aetnabetterhealth.com/Kentucky/event. Finally, I just wanted to mention one of the most frequently asked questions that we've been getting as we're implementing this new model here at Aetna Better Health with the state of Kentucky is really about existing relationships with providers who are not enrolled with Aetna. The SCI program is really focused on engaging our members and their networks of support. And we really appreciate the importance of SCI members' established relationships with their providers. So we would like to help maintain that relationship so the SCI eligible youth can access all of these wonderful supports and services that SCI offers, but also still maintain that invaluable relationship with their providers. So we want to let you know that caregivers or providers can reach out to us directly and reach out to our SCI provider relations team to get enrolled in our network so that the providers can continue to see our members. Our contact information is going to be on a one-pager and in our mobile app, and we will be sure to share that with you. I'll drop our phone number real quick. It's 1-855-454-0061, or reach us by email at kyproviderrelations@aetna.com. And there's no need for a special contract to provide services to SCI members. All participating Aetna Better Health of Kentucky providers are available to see our SCI members under their existing contract with Aetna. Again, we're so excited and honored to be partnering with KYA and to be partnering with all of you. I am certain that we are going to have a very powerful Children's Advocacy Week. Thank you for this opportunity to spend some time with you today.
All right, thank you to Aetna Better Health of Kentucky for their support of Children's Advocacy Week. And if you all have questions about the SCI program or providers or kids you serve, we can connect you with the person at Aetna who may be able to answer those questions. So before we leave today, I just wanted to, plant the seed of like, what do we do with this? And you got some marching orders from Representative Fleming about connect with your legislator. Do that now, but he's definitely saying do that during the, kind of the off season, if you will, and give your legislators a call to action. We also want to point you towards, as Patricia and Courtney referenced the bill tracker where you can follow the bills as they move through this second half of the legislative session, and reach out to your legislators, whether it's about those bills or even just to say thank you or to introduce yourself. It's really important for them to hear from constituents. And stay connected throughout the rest of Children's Advocacy Week through the app, or you can check YouTube for the recordings of all of these sessions, and follow not only Kentucky Youth Advocates, but all the partner organizations on social media. And just a final shout out and thank you to all of the Children's Advocacy Week sponsors who you can see on these images on the screen. So thank you to all of you for joining today, and please reach out to your legislators, reach out to one another, and have a great rest of your Children's Advocacy Week. Bye, everyone.